Hello and welcome to the Aaron Werner podcast on iCode Media. I just listened to a discussion between Chris Wolfe and Amanda Legge on the podcast. If you haven't listened to their discussion, I'll put the link in the show notes below, but it just launched this week and it was a fantastic discussion. Barbara Benedict was on as well. And Chris and Amanda were looking at really discussing at-home AMD monitoring with the ForseeHome. And I thought it was a really interesting and neat discussion and wanted to just share some of my reactions to it. Before we get into what my reactions are, though, I want to share why this is important to me. I believe I've talked about this on the podcast. It's probably been a while, but early in my career as an optometrist, in fact, let me go back to the day I graduated as an optometrist. And for those who don't know, I'm a fifth-generation optometrist. I grew up in the back of Grandpa's practice, and then I worked in Dad's practice. I was edging lenses, the glass lenses, on a flywheel when I was in fifth grade, sixth grade. And then as a high schooler, I worked with patients in the practice. So I'd been around optometry for a bit, and I thought I was good at it when I graduated. And Dad said, "Congratulations on graduating. You're going to be a real doctor in about 5 years." And at the time, I was taken back because I'm a doctor now. I passed boards. I graduated. I've got my license. We're good to go. And 5 years later, I looked back and realized Dad is right. And now looking back even further, the longer I am in the field of optometry, the more I realize that we have to learn, and it's a growing field, and I love it. But there was one patient in particular that has stuck with me. She's since passed. She was a wonderful, sweet old lady, and always, big smile, big hug. And I remember seeing her, and she had some drusen. She had some intermediate macular degeneration, and I was really, really good at convincing my glaucoma patients they had glaucoma, they needed to take drugs. I was really good at convincing somebody with a refractive diagnosis that they needed glasses or contacts. I was really good at talking to parents of kids with binocular visions to help them understand that they needed to have a binocular evaluation and vision therapy. For whatever reason, I was not good and not overly comfortable talking to my patients with early AMD, intermediate AMD, dry AMD with some drusen, and having an honest conversation with them about where they were and what the risk factors were. I think because unless they were a smoker, there wasn't a whole lot we could do other than say take some vitamins, and for whatever reason that didn't feel very medical to me. I look back in hindsight now, and I'm embarrassed by that, and I laugh at it, and not laugh in a ha-ha funny way, but just laugh at how silly that notion is. But I had it. Hopefully none of you find yourself in the same boat, but I want to be honest, and that's where I found myself. So I would see this patient. I'd have her back frequently. We'd look. I would talk with her about needing to take some vitamins and eat better and all that kind of stuff, but I don't think I really enforced it and pushed it as much as I could. Long story short, she converted to wet. We sent her over to retina, and she really lost all functional vision in the one eye. Her other eye later converted to wet, but the retina surgeons caught it a little bit sooner, and so we were able to at least help her maintain functional vision in her second eye until she passed away. Wonderful grandma, lots of grandkids, and I look back at that situation and say, what could I have done better? At the time, I believe I was using the tools that I had. Obviously, we have more tools now. We know more now, and that's where this discussion between Chris and Amanda really hit home for me. The other thing that I've since become aware and learned is that I viewed myself as the hero. I went to school for 8 years. I spent a lot of money on student debt to go to school. I had all the information. I had all the tools. I was the hero. My patients were the damsels in distress, and I was going to show up with my cape and my superhero mask and save the day. They just needed to listen to me. What I have come to believe now is that I'm not a hero, but I'm a guide. I'm helping the heroes who are my patients along their journey and their visual journey and their health journey. And as a guide, I can't make them do anything. I can't come in and swoop and save the day. All I can do is help give them a plan, help them understand what happens if they follow that plan, hopefully to get something good or avoid something bad, and then give them a call to action and really be there, continuing to cheer them on, call them to action, and be their supporters. This is where I really believe that ForeseeHome comes into play on AMD monitoring. Right? We all know that we don't want our patients to convert to wet AMD, and if they are going to convert to wet AMD, we want to catch that as soon as possible because the treatments are fantastic. Right? The anti-VEGFs make a huge difference, have a huge impact, and the sooner we can catch somebody who's converting and get them to the proper care, then the better off that they're going to have, the better guides we're going to be, the better we're going to help our superheroes live full and effective and high quality lives visually, and overall health as well.
The Myopia Collective. CooperVision and the AOA have partnered in a groundbreaking initiative to change the way optometrists in the U.S. treat children with myopia. The purpose of the Myopia Collective is to rally the profession of optometry and its allies to interrupt the status quo and elevate the new standard of care for children with myopia. Every individual is encouraged to become a member of the collective. By joining, you commit to taking action to help slow the progression of myopia in children. You'll receive updates and information about the collective and its work in the fight against myopia, gain access to educational opportunities and resources offered by the collective, and hear from change agents, the ambassador optometrists selected to serve as advocates for community and policy change that facilitates the mission of the collective. Scan the QR code or click on the link in the show notes to join the collective today.
In the past, our focus revolved around prescribing MacuHealth or MacuHealth Plus to patients at risk of macular degeneration, while also recommending it to collegiate and professional athletes for enhanced contrast sensitivity in sports performance. However, this year's introduction of the Life Meter has been a game changer. The Life Meter revealed a concerning truth. Many of my patients have alarmingly low skin carotenoid levels, indicating potential deficiencies in essential body tissues like the retina and brain. Supported by over 30 peer-reviewed publications, Life Meter's accuracy, consistency, and effectiveness has been demonstrated across 2,000 subjects with diverse backgrounds. With this newfound insight, I can now have meaningful conversations about carotenoid levels with all of my patients, even those who may seem outwardly healthy. To learn more about this empowering technology, feel free to contact your MacuHealth representative or click on the link in the show notes. Together, let's optimize patient care and elevate their well-being.
Again, if you haven't listened to the discussion with Chris and Amanda, go back and listen to it. I'm going to reference a few things. I'm not going to dive super deep into what they talked about because I'm assuming that you've looked at it. What I think is really neat, though, about the ForeseeHome is how it works, because Chris and Amanda had talked about how giving somebody a home Amsler, they didn't have a whole lot of faith in it. I don't either. I bought a whole bunch of Amsler grids and put our logo on it and our information on it to give to patients, mostly as a marketing tool. I wanted our name to be seen by the patients or anybody who went to their house and saw those little cards. I don't believe that most patients use them. I think they use them even less than they use the warm compresses we give them for dry eye. But it's what we have and it's standard of care, so I still do it. What I do more so, or rather in addition to the giving patients a home Amsler, is I talk to their significant other, somebody who's with them all the time, kids, whoever's usually in the room with the patient, and I encourage them to do a facial Amsler with our patient who has AMD. And same way you would do a home Amsler grid, but hey, remind you real quick, look at me, cover an eye, stare right at my nose, tell me if any part of my face looks different, looks odd, and then do it with the other eye. At least now, hopefully, I have two people having an accountability, and they're going to do the test. I don't still put a whole lot of stock into the fact that they're going to do it properly. And Amanda brought up on the discussion that most of these patients are elderly and they're wearing progressive edition lenses, and that's going to induce some sort of metamorphopsia just in general. The cool thing about the ForeseeHome is it's pretty simple, and it leverages a type of visual acuity that we talked about in school, but we haven't talked about a whole lot outside of school, or at least I haven't, which is Vernier acuity. And that's the ability that humans have to see the difference between two line segments or grading, see those tiny misalignments. And that's exactly how the ForseeHome works. It shows a line with dots, and then it'll have a little bump, if you will, in those dots, and the patient simply just have to click on where that bump is. They've got a fixation target, and they're looking at that line, and whenever there's a little bump in that line, they are to take their mouse, little pointer, and just click where the bump is. Now the bump is known where it's pre-measured or preset during the test. So just like a regular visual acuity test, we know when the light's going to flash. The test does, so the ForseeHome knows where that little bump is. However, if it tests over an area of retina that's sick, there's going to be an induced bump, an induced metamorphopsia, and that's going to really measure where the area of metamorphopsia is for the patient. So it's incredibly accurate, it's incredibly easy to use, and I think it's pretty novel use of Vernier acuity to really help patients and detect where any areas of metamorphopsia are, this use of hyperacuity. So I don't think that patients will have any issues with it. If anything, my elderly patients spend a lot more time on the computer than we give them credit for, and they're pretty useful in it. Some of them, I think, actually understand and how to troubleshoot computer stuff better than young teenagers, because at least some of the teenagers I've encountered, they know how to use the technology, but when their technology on their phone doesn't work, they don't know how to fix it. They kind of are at a loss. So we can debate who's better at technology and using computers, but this is pretty simple, pretty straightforward, and it really is a much better way of consistent monitoring over time, and consistent monitoring where patients don't have to come back to the practice as frequently. We still like to see them in our office on a 3-month schedule. That just works really well. But in between those 3 months, we want to make sure that nothing's happening. I think the biggest challenge that we all have when looking at managing our AMD patients is the same challenge we have when we're looking at managing our dry eye patients, and looking at managing our glaucoma patients, our myopia management patients, whatever the case is, and that's having a system. Really having an organized, dedicated flow so we know exactly what we're going to do at each step of the way. How we're going to diagnose these patients, how we're going to find these patients, or the patients with these conditions, what we're going to do when we find patients with these conditions, how we're going to talk and educate the patients, and I don't mean educate in the sense of lecturing them, but helping them become aware of their condition, and then what we're going to do. So going back to the idea of our patients are the heroes in their story, and we're the guides. How do we help that hero understand what their predicament is, what their problem is? Often they come in saying, I need new glasses. The routine eye exam is the gateway into our office. So they come in saying, hey, I need new glasses. Maybe they're saying my eyes are dry, and maybe they have a concern because their parents or family members had a sight-threatening condition like glaucoma or macular degeneration, whatever it is that brought them in the door. Our job is to do a thorough assessment of their visual system and their eye health. Should we catch an issue that they weren't aware of, like a drusen, and I really like, by the way, how Chris and Amanda paused to talk about what the definition of intermediate AMD is, and that's that one large drusen the size of the retinal vein, central retinal vein coming out, which I was calling that early in my career, just early drusen, maybe the beginnings of some early macular degeneration, where that definition clearly is intermediate macular degeneration. It's much more serious than I was making it. But anyway, once we diagnose that, how do we talk to a patient and say, here's what you have? How do we follow up with that patient? How do we give them a plan as to what we're going to do to help them with this predicament? right? What can they do, because they're the ones who actually have to do the work? And then how do we call them to action? What are the steps we're going to take? What are the steps that our team is going to take? And why is it important that they follow that action? It's important that they stay on top of the visits with us. It's important that they stay on top of their home monitoring. It's important that they stay on top of taking their supplementations. And in our office, we have the life meter, so it's important that they stay on top of getting their finger carotenoid scan results so that we can monitor how well their supplementation is working. We want to stack all the cards in their favor. Why should they do that? Because we're going to try to save the site that they have. And if they don't do it, things don't just stay where they're at. They actually get worse based upon all the research and data that we know. But ultimately, they're the heroes in their story. They need to be the ones to take action. Our job is to guide them through that process. So if you don't have a very clear process of what you are doing, how you monitor this, how you talk to your patients, what your staff does, how often you see them back, what tests you're going to typically run, sit down and create a plan. If you need help creating that plan, Chris and team over at iCode Education have an amazing course called Comprehensive Optometry Simplified that walks you through building these pillars. Once you start that process, we have at our office. It's pretty easy. It involves everybody, and it's really neat to know what your game plan is. I've never seen a professional sports team go into a match without a plan. I think it's silly that we go into our professional field, right, our sport game, if you will, without a set plan for every condition that we're going to come into. Now, certainly there are expectations or exceptions to the rule, and that's when, as clinicians, we make good judgment. But if we are consistent in how we engage each of these conditions or patients with these conditions and what we're going to do, it makes it a whole lot clearer for our team, makes the experience for the patient significantly better, and it formalizes this process. Right? We all went to school to have a formal process. A lot of what we do in our worlds have a very set formal process, and it's important that we have these processes within the practice so that we can focus on the patient and not what we're going to do next. So if you haven't taken a listen to Chris and Amanda's discussion, I strongly encourage you to go back and do so. Perhaps even share it with your team. I know I am with my team, so that they understand what we are talking about. I think it's important for the entire office to hear discussions like this, not just doctors, but the entire care team that we have in our clinics, so that they know how important treating diseases like macular degeneration is, how important it is to be aggressive in our treatments and our monitoring of patients with these conditions, so that we can achieve our goal of protecting sight and improving the quality of life of our patients. If you don't have a set process, I really encourage you to sit down and dedicate some time to doing so. Like I said, if you need some help, reach out to iCode Education. There is a link in the show notes that will give you a discount on that. It's fantastic education. It's fantastic hands-on workshopping that they'll walk you through, because we don't want you to, and I don't want you to look like everybody else. I want you as a clinic, as a doctor, as a care team to do what you do best, the way you do it best. And so instead of saying, hey, here's the set process everybody should follow, while we do have clinical guidelines and preferred practice patterns, you still need to figure out what works best in your office and for your patients and your team. And so setting down and creating that process is fantastic. If the ForeseeHome is not part of your strategy, I strongly encourage you to look at making it part of your strategy. The link to their site is also in the show notes. Go take a look. It's a very well done site, both for patients and for doctors, so you can see exactly what you're working with. And feel free to reach out with any questions, and have a wonderful day.